Hello, good afternoon everyone. Am I audible and visible? Okay, so alright, so welcome to this next episode where we are going to have a look at the questions on demography and contraceptives. I hope all of you are following this roster that we have. So we are done with EPID, we are done with screening, we are done, and today we'll be doing demography and contraceptives. Okay, good afternoon. Tomorrow there's no class, but again on the 27th you'll have vaccines and NIS, and the quiz again will be today at 8 p.m. on Telegram. Okay, please don't miss that. So it's kind of a revision session again. Okay, so let us start without looking here and there a lot. So let us go to the first question. Community X has 30% below 15 years of age, okay, and 10% over 65 years of age. What is the dependency ratio for community X? What is the dependency ratio for community X? Anybody can calculate this? Okay. Alright, the PDF. The PDF after the session I will put it out in the group, but let me put the unannotated PDF also. Just give me one moment. It will become easier for you. Till then, solve this MCQ, everybody, very important, and you can find the PDF on the Telegram group. Go and check it out, and then you can write in that. Okay, the PDF has been shared on the Telegram group. You can take that unannotated one and you can start writing in that one. Okay, so what is your answer here? Community X has 30% below 15 years of age and 10% over 65 years of age. Dependency ratio for community X. Okay, now remember, dependency ratio, or the first rule of numericals that I have given you, the first thing is that जब भी numerical आए घबराना नहीं है, you don't have to panic. ठीक है, आराम से याद करो कि इसका फॉर्मूला क्या था. डिपेंडेंसी रेशो में याद करो, देर इज़ वन यंग एज डिपेंडेंसी एंड देर इज़ वन ओल्ड एज डिपेंडेंसी. ठीक है, यंग एज डिपेंडेंसी क्या होता है? चिल्ड्रन बिलो 15 years, okay, and elderly, this is young age, and elderly beyond 65 years, okay, that is old age. They are dependent on which population? They are dependent on the working class. Okay, they are dependent on the working class, जो कि कितने से कितने के बीच है? 15 to 64 years. Okay, now here you can see that 35% are below 15 years. So below 15 years कितने लोग हैं? 30, राइट, एंड ओवर 65 ईयर्स कितने लोग हैं? ओवर 65 10. ठीक है, सो टोटल डिपेंडेंट्स कितने हो गए यंग एज एंड ओल्ड एज मिला के? हाउ मेनी आर द टोटल डिपेंडेंट्स? इट इज़ 40, राइट? 30 plus 10, 40. So now what is the working class, guys? How much will be the working population or the working class? That will be 100 minus 40, which will be 60. ठीक है, now all you need to do is you put it in the formula. So what will be your dependency ratio, guys? What will be your dependency ratio? It will be total dependents who are 40 divided by the working class, which is 60, and since it's given in percentage we have to multiply by 100. ठीक है, so कितना आया सबका आंसर? Very good, this came as C. Alright, so just a quick revision, and we also got this question in our FMG exams, a similar kind of question this time also, and it is a PYQ which has been floating for quite some times in different examinations. ठीक है, so demography में से एक numerical expected है dependency ratio. Thumbs up everybody. Then we'll go to the question number 2 for the day. Now since we are doing demography, we have to revise the demography transition model. ठीक है, क्योंकि हम demography कर रहे हैं तो हमें demography transition model तो revise करना है. One second, let me check. क्योंकि हम डेमोग्राफी कर रहे हैं. Okay, moving to the next question for the day. All right, now look at this question. All right, I have given you two countries. Okay, I have given you two countries, country A and country B. Instead of asking you directly that which particular stage it is, I am going to give you two values. ठीक है, जैसे country A का value 2011 में बर्थ रेट का कितना है, एंड व्हाट इज़ द वैल्यू ऑफ बर्थ रेट इन 2021. ठीक है, सिमिलरली फॉर डेथ रेट, व्हाट इज़ द वैल्यू इन 2011 एंड व्हाट इज़ द वैल्यू इन 2021. एंड फॉर कंट्री बी वी आर लुकिंग एट बर्थ रेट एंड डेथ रेट इन 2011 and 2021. So try to look at these values and can you identify which stage is this particular, are these two countries in? Which stage of the demography transition model are the two countries in? Can you identify over here? बिल्कुल there's no rush over here guys. Instead of asking you directly कि ठीक है स्टेज 4 में क्या होता है, हमें पता है स्टेज 4 में लो बर्थ रेट लो डेथ रेट है, लो स्टेशनरी. हमें पता है स्टेज 5 में CBR इज बिलो CDR. बट अगर ऐसे क्वेश्चन आ गया तो आंसर क्या होगा? ऑल राइट, 2 people have given the answer. What about the others? Think and mark. See, if you look at country A को देखो, 2011 में it is 45.6 and 2021 में also it is 45.6. That means for country A guys, birth rate remains the same. ठीक है, CBR is the same from 2011 to 2021. But look at the death rate, look at the CDR. It was 15.2 and now it is 13.3. That means death rate has started to decline. Now you tell me which is this phase where the birth rate remains the same and the death rate has started to decline. ये कौन सा स्टेज है जहाँ पे बर्थ रेट सेम रहेगा बट डेथ रेट पहली बार शुरू हो जाएगा decline करना? Which is this? Of course this is stage 2, right? The birth rate is still high and the death rate starts to decline. So this is what? Stage 2. Okay, this is what? Stage 2. But look at country B now. Look at the birth rate, everybody. Look at the birth rate, 13.3 and 13.2. So CBR for country B both 13.3 and 13.2. तो क्या हुआ? Birth rate low है फॉर कंट्री बी. और डेथ रेट को देखो, CDR को देखो, 5.6 और 5.5. अगेन डेथ रेट भी दोनों जगह लो है, इवन इन 2011 एंड इवन इन 2021. एंड विच इज दैट फेज वेयर बोथ बर्थ रेट एंड डेथ रेट आर लो? ऑब्वियसली इट इज स्टेज 4. सो व्हाट इज योर आंसर? स्टेज 2 एंड स्टेज 4. हाउ मेनी ऑफ यू वर एबल टू डू दिस? वेरी वेरी गुड गाइज. ऑल यू नीड टू think, you have to look at the values. Now in country A हमने देखा birth rate is still high in 2021, death rate starts to decline. And in country B क्या हो रहा है? birth rate and death rate दोनों ही low है. So what is that phase? Stage 4. All right, everybody. Now they might not ask you like this. They might ask you directly. जैसे buzzwords होंगे guys. European country किस stage में होता है? Anybody? European countries are always in stage 5. ओके, CBR इज लेस दैन CDR. इंडिया कौन से स्टेज में है? स्टेज 3 में. ठीक है, लेट एक्सपैंडिंग. ओके, चलो नाउ लेट अस हैव अ लुक एट this image. I hope you remember this was the demography transition model. Here you can get the labeling of this model also. ठीक है, demography transition model. इसमें क्या होता है? Let's have a quick revision. If you talk about the stage 1, birth rate high, death rate high. तो population क्या है? Stable है. So that is what? CBR and CDR. Okay, both are high, population stable. So this was what? High stationary. Okay, the first stage is high stationary. Now look at the second stage. Birth rate is still high, death rate, hospital services अच्छी हो जाती हैं, death rate starts to decline. Birth rate अभी भी high है, death rate घटने लगता है. तो क्या होता है? पॉपुलेशन को एक्सपैंड करेगा. प्रॉब्लम क्या है? इट्स गोइंग टू एक्सपैंड एट अ फास्टर रेट. So that is known as what? Early expanding. Population expansion. Okay, population explosion. Then stage 3 में for the first time birth starts to decline. As you can see over here in the stage 3. For the first time guys, purple line को देखो, it starts to decline. And death rate continues to decline. Okay, so this is what? This is late expanding. Population is still growing but at a slower rate. Finally, birth rate, death rate दोनों low है in this stage. Low stationary. Okay, and ultimately stage 5 में क्या हो जाता है? Population is declining. Why? Because CBR is below CDR. Am I clear? ठीक है, ओके. एक और चीज़ रिवाइज कर लो. डेमोग्राफिक गैप क्या था? CBR माइनस CDR. Where is the demographic gap minimum in the image? Where is the demographic gap minimum? You can see 1 and 4. Where is the demographic gap maximum? The stage of population explosion. तो वो कौन सा स्टेज है? ये वाला स्टेज है, late stage 2. Okay, late stage 2. And where does it starts to contract guys? Starts contracting. सबसे पहले birth rate कौन से स्टेज में कम होना शुरू करता है? स्टेज 3 में. सो वहाँ पे वो स्टार्ट होता है कॉन्ट्रैक्टिंग. सो ये कौन सा स्टेज है? अर्ली स्टेज 3. एंड वेयर इज द डेमोग्राफिक गैप नेगेटिव गाइज? इट इज ऑब्वियसली इन स्टेज 5. ठीक है, जस्ट अ क्विक रिविजन. नाउ नीट पीजी एग्जाम्स में मोस्टली मॉडल का नाम पूछेंगे. INI-CT में हमेशा इंटरप्रिटेशन पूछ लेते हैं, बट हमें तैयारी दोनों रखनी है. वी हैव डन अबाउट द मॉडलिंग एज वेल एज वी हैव लुक्ड एट the interpretation. ठीक है, चलो let's go to the next stage, next question for the day. We have almost 15 questions. Okay, now tell me this one, demographic trap symbolizes which phase of demography cycle or demography transition model? You all know which phase. कोई भी country doesn't want to get stuck in that phase. What is that phase, everybody? Early expanding, late expanding, low stationary, declining. Very good. Early expanding. Early expanding. All right. High birth rate and low death rate. Death rate starts to decline. This is what? This is stage 2. इसमें क्या होता है? Population explosion. ठीक है, country stage में फंस गई है. Population explosion. The population is growing at a faster rate. Okay. All right. Moving to the next question for the day. Alright, let's revise a few points about fertility indicators, which can obviously come. You are the medical officer of a PHC. Data is being collected at PHC and CHC level to evaluate the effect of National Population Policy. All medical officers have to submit data regarding appropriate magnitude of complete family size in the population. Which of the following indicators will you calculate, guys? Complete family size का indicator कौन है? Gross reproduction rate, net reproduction rate, general fertility rate या total fertility rate. So one of the highly expected topics, fertility indicators. ठीक है, इसमें से question आ सकता है एग्जाम में. बताओ. Very good. Total fertility rate was complete family size. Okay, complete family size. Now if I ask you, anybody in the class, if I ask you कि there is a couple, okay, the father, the mother, and they have 2 children. Okay, one is a boy. Okay, one is a boy and one is a girl. So can you tell me the family size of this particular family? 1 2 3 4. कितना है family size इस particular family का? 1 2 3 4. Remember, family size will mean the number of children that the couple is going to have throughout their reproductive lifespan, meaning from 15 to 49 years. Okay, एक woman को कितने children होते हैं? So the buzzword for TFR was what, guys? The buzzword for TFR was total children. ठीक है, buzzword क्या था TFR का? Total children एक couple को होंगे from 15 to 49. Like suppose a woman is 35 years old now. She has 2 children. So her family size right now is 2. But by the time she turns 49, she has 3 children. That is complete family size. Am I clear? ठीक है. Now next thing. Out of these children, how many are girls? So that is what? Gross reproduction rate. Okay. Total girls. Your buzzword for GRR is girls. Okay. Out of those children, कितनी लड़कियां हैं? That is GRR. Now, how many girls are going to stay alive considering current mortality and female feticide, infanticide? Okay, सारे children is TFR, total children. Out of them, how many are girls? GRR. Out of them, how many going to remain alive? That is net reproduction rate. So, mortality dependent fertility indicator is which one, guys? Net reproduction rate. ठीक है, mortality dependent fertility indicator क्या है? Net reproduction rate. सुबह किसी ने क्वेश्चन भेजा कि सेंसिटिव इंडिकेटर ऑफ फैमिली प्लानिंग सर्विसेज मैम कौन सा है? हमेशा याद रखो, सेंसिटिव पूछ रहा है, इसका मतलब दैट इट इज समथिंग विच इज derived after many calculations. Okay, which is the most sensitive indicator? The most sensitive indicator for achievement of family planning services या wellness of services is net reproduction rate. ठीक है, all right. Okay, and one more thing, guys, if somebody asks you that what is your, let's have a look at these formulas once. Okay, if somebody asks you what is crude birth rate is nothing but total number of live births. Okay, not total births. And crude birth rate में per 1000 mid-year population. In mid-year population कब लेते हैं? 1st of July. अब mid-year population में तो men भी है, elderly भी है, बच्चे भी हैं. कैन एवरीबडी गिव बर्थ टू अ बेबी? नो. हु आर एक्सपोज टू गिविंग बर्थ टू बेबीज? women. Every age group? No. Only in reproductive age group, 15 to 49. So total number of live births per 1000 women in reproductive age group. ये कौन सा formula हो गया? general fertility rate. Okay, this is what? This is general fertility rate. Now again, look at the denominator. You have women in reproductive age group 15 to 49 years. अब कोई woman जो let's say 22 years की है unmarried, and कोई woman who is let's say 25 years की married, who is more exposed to giving birth to babies? Obviously, due to obvious reasons, the woman who is married. So हमने इस definition को और specific किया. How did we make it? Total number of live births per 1,000 married women, okay, in reproductive age group. This is what? General marital fertility rate. Okay, just look at the denominator. It will come very easily to you. ठीक है? And then what was the definition? Total number of children a woman will have throughout her reproductive lifespan. Your buzzword here is बच्चे, children. This is what? TFR. Okay, total fertility rate. All right, and total या average number of girls. अब उन बच्चों में से लड़कियां कितनी हैं? This is what? GRR, gross reproduction rate. Okay, this is what? Gross reproduction rate. Okay, and out of them, guys, how many girls are going to remain alive? Okay, considering the current mortality rate, कितनी लड़कियां are going to remain alive? So this is what? Net reproduction rate. ठीक है? And last point यहाँ पे before we move ahead, किसी भी country के population को stabilize होने के लिए a direct PYQ from number of exams, NEETPG में भी आया, FMG में भी आया, कोई भी country के population को stabilize होने के लिए TFR कितना achieve करना है? 2.1 means we have achieved the 2 child norm. Son or daughter either will do. ये कब होगा? जब net reproduction rate 1 हो जाएगा. ठीक है? और ये कब होगा? When at least more than 60% of the couples in India use a contraceptive method. ठीक है? More than 60% of couples in India are using a contraceptive method. Okay? What is the current TFR अभी इंडिया में? The current TFR in India is how much, guys? It is already 2.0. All right, and couple protection rate हो गया है 66.7%. ठीक है? Just for your revision. Okay, chalo, moving to the next question of the day. So we've done fertility indicator. It is obviously very important. ठीक है, चलो, so just quickly mark this answer. General fertility rate is, now please don't make a mistake, number of live birth in a woman in reproductive age group. Number of live birth 15 to 44 bolo, but ideally it is 15 to 49. That's okay. Number of live birth in unmarried? No. Number of children? This is what? TFR. Okay. Number of abortions? That is child abortion ratio. Woman, okay. So here, very good. The answer is option A. Okay. All right, general fertility rate. ठीक है. Now one more image based question from demography is this one. ये किसका image है? All are features of the following population pyramid except, now obviously this is a image of population pyramid. So can you tell me this is an image of a developed country or a developing country? This population pyramid is an image of which one, guys? Developing country. Why is it developing? Broad base. Okay, let me revise the pyramids with you. See, look at this one. This one is, you'll just have to follow. Okay, this one is developing country, guys, and this one over here is developed country. Now you look at the base of the developed country. It is narrow base. Okay, it is narrow base. Here what is it? It is broad base. Okay, so narrow base matlab low fertility. Okay, low fertility, and broad base matlab more fertility. Okay, then if you look at the apex, apex here is what? If you look at the apex here is narrow, क्योंकि elderly कम है. यहाँ पे apex क्या है? Obtuse है. ठीक है, इट इज़ नॉट नैरो एपेक्स, यहाँ पे ऑब्ट्यूस है, मोर एल्डरली है. टॉलर कौन सा पिरामिड है? ऑब्वियसली डेवलप कंट्री का टॉलर है, क्योंकि लोग ज़्यादा लाइफ जीते हैं वहाँ, मोर लाइफ एक्सपेक्टेंसी. यहाँ पे क्या है गाइस? शॉर्टर पिरामिड. शॉर्टर क्यों है? क्योंकि यहाँ पे क्या हो रहा है? देयर इज लो लाइफ एक्सपेक्टेंसी. दिस वन इज अ कंस्ट्रिक्टिंग पिरामिड. ओके, इट्स अ स्पिंडल शेप्ड. ओके, दिस वन इज व्हाट? स्पिंडल शेप्ड. ऐसा लग रहा है कि कोई इस पिरामिड को कंप्रेस कर रहा है, कंस्ट्रिक्ट हो रहा है. ठीक है, दिस इज व्हाट? कंस्ट्रिक्टिंग टाइप. एंड व्हाट is this one? This is upward triangular. You're first going to draw the base and then you're going to move upwards. So this is what? Upward triangular. Okay, this is what? Upward triangular. Just a quick revision. Okay, now come back to the question. The question said all are features of the following population pyramid. So this was a developing country. ब्रॉड बेस्ड डिनोट्स मोर फर्टिलिटी, यस. एक्सपैंडिंग टाइप, यस, ऐसे करके पिरामिड फैल रहा है. Asymmetrical, yes, because there is no ideal sex ratio, okay, for developing country. India ने पहली बार रिकॉर्ड किया है 1020 females per 1000 males, but that needs to be sustained, okay. Downward triangular, no. ये कैसे है? This is upward triangular, ठीक है. All right, everybody. Okay, can we go to the next MCQ? Chalo, let's go to the next MCQ. Now let's do some questions about contraceptives. Quick, we will look at contraceptives in 10 to 15 minutes, okay? Question number 7 for the day. A woman underwent an IUD insertion in a PHC. What is she most likely to report in the future? Uterine perforation, abdominal pain, pelvic infection, vaginal bleeding. ये एक favorite MCQ है contraceptives से कि वुमन ने आईयूडी इंसर्ट किया है, उसको क्या प्रॉब्लम हो सकता है और उसको क्या एडवाइस दोगे, ठीक है. सो इसका आंसर क्या है? वी ऑल नो दैट द मोस्ट कॉमन प्रॉब्लम फॉलोइंग आईयूसीडी इंसर्शन इज bleeding, okay. What is it? Bleeding. But this bleeding, guys, this is the most common side effect, okay. This is the most common side effect. But this side effect, is it something to worry about? No, it's which is physiological bleeding, okay. It gets corrected itself in 2 to 3 months, okay. So what you have to do, the woman, tell the woman, will you immediately take out the IUCD? No, you cannot do that. You have to reassure her, reassurance, and put her on iron tablets if needed. Ferrous sulfate, okay, tablets you can put her on for 2 to 3 months, okay. So most common complication following IUCD insertion is bleeding. And what is the second most common complication, guys? The second most common complication is pain. But please remember, second most common complication pain है, but pain is the most common cause of removal, ठीक है. pain क्या है? pain is the most common cause of removal. सबसे common cause of removal क्या है? pain है, ठीक है. Okay, all right. So this question can turn up side effects like you can see vaginal bleeding, pain, uterine perforation. Obviously pregnancy can happen. Ectopic pregnancy is one of the problems, and ectopic pregnancy is now a relative contraindication for IUCD insertion. It's not an absolute contraindication. अगर किसी को ectopic pregnancy की history है, you have to be careful while inserting an IUCD. All right, expulsion of IUCD. चलो, let's move ahead. Yeah, let's revise absolute contraindication for IUD. एक side effect IUD से आता है, एक contraindication आता है और एक image identification आता है, ठीक है. तीनों हम लोग revise करेंगे. Question number 8 आओ. Absolute contraindication for IUD are all except, of course, pregnancy. You will never, if you suspect a pregnancy, you can never use any contraceptive. Undiagnosed vaginal bleeding, yes, vagina से bleed है तो obviously no IUD. Pelvic, cervical से कोई discharge आ रहा है, cervix से, that's a relative contraindication. PID, current PID is an absolute contraindication. Past history of PID is a relative contraindication. Uterine malformation. Now, anyone who has multiple sexual partners, you will never advise them an IUCD, okay? Like commercial sex workers, उनको IUCD advice नहीं करना है. उनको National AIDS Control Program क्या provide करता है? Female condoms, ठीक है? All this can come in your conceptual MCQs. So, have a look at this contraindication. We will remove previous ectopic pregnancy now. All right, previous ectopic pregnancy is relative contraindication, ठीक है. previous ectopic pregnancy is relative. Suspected pregnancy relative में anemia, bleeding, menorrhagia. PID current, history of PID relative, vaginal bleeding absolute, ठीक है. cervix से discharge relative, cancers absolute, but any congenital malformation, distortion, fibroids, all those are relative. Why unmotivated person? Because the woman has to constantly feel for the thread, okay. if she is not able to feel the thread, that means the contraceptive कहीं expel हो गया हो, कहीं कुछ perforate ना हो गया हो, something. all right, so that is why we need a motivated person जिसको you're going to advise. like you have to ensure, you're assured कि she feels for the thread every day, okay. Now tell me over here, you have 3 images A, B, C. Question is, out of these 3, which 2 are being provided freely by Government of India under National Family Welfare Program till the level of sub center? कौन से 2 IUCDs provide हो रहे हैं, ठीक है. ओके कौन से दो इसमें से यूज हो रहे हैं गाइस? विच टू आर बीइंग यूज्ड एवरीबडी? वेरी गुड, नॉट बी गाइस। पहले तो ये कॉपर टी कंटेनिंग डिवाइसेस है, क्यों? इसमें ब्राउन कलर का कॉपर वायर याद रखोगे। फिर हमने कैसे पढ़ा है? कंप्लीटली स्ट्रेट। ओके, दिस वन इज विच वन? कॉपर टी 380A. ओके, व्हाट इज 380? 380 millimeter square of copper wire is wound on the horizontal and vertical stem, so that's the surface area. Shelf life of 10 years. ये क्या है? कॉपर टी 380 AG सिल्वर आयन है, इसका नाम क्या है? नोवा टी. ओके, एंड व्हाट इज दिस वन? मल्टी लोड. हाउ विल यू आइडेंटिफाई? ब्लू कलर का थ्रेड इसमें होता है. दिस इज व्हाट? कॉपर टी 375. दिस इज व्हाट? मल्टी लोड. दिस ऑल्सो हैज अ शेल्फ लाइफ ऑफ 5 years. एंड रिमेंबर A and C, okay, A and C, these two are provided freely under National Family Welfare Program. Provided freely under National Family Welfare Program. Okay, provided freely under National Family Welfare Program. ठीक है? Okay. Let's move ahead. Now, instead you don't see the brown color copper wire, you simply see white colored. Okay, so the one which has a little inverted T, tilt, like the horizontal axis is not completely straight. ये क्या है? ये myelina है. Myelina, out of all the intrauterine devices, they are what? Third generation. Copper containing वाले सेकेंड जनरेशन है. फर्स्ट जनरेशन लिपीज लूप एंड ग्राफेनबर्ग रिंग, दे आर नो लॉन्गर यूज. ठीक है, बट अभी एफएमजी एग्जाम के लेटेस्ट में लिपीज लूप का इमेज पूछा था. सेम लिपीज लूप हमने पढ़ा हुआ है, अगर वीडियोस में भी देखोगे. दिस इज लिपीज लूप, ऑल राइट. एंड लिपीज लूप अब यूज नहीं होता है, इनर्ट है, हाई फेलियर रेट. ठीक है, माइरीना एवरीबडी हैज द लीस्ट फेलियर रेट आउट ऑफ ऑल द कॉन्ट्रासेप्टिव्स. ठीक है, आउट ऑफ ऑल द इंट्रायूट्राइन डिवाइसेस, लीस्ट फेलियर रेट. रिलीजेस 20 माइक्रोग्राम ऑफ लीवोनॉर्जेस्ट्रल per day, and इसकी shelf life अब up to 7 years हो गई है. 5 to 7 years, so we can go up to 7 years. This is what? This is over here, all right. So this is myelina, which is most expected in your exam. Progesta cert is not that expected. ठीक है, ये इंडिया में मिलता भी नहीं है. Releases 65 microgram of hormone per day. ठीक है, remember this, myelina, they are all third generation. चलो, question number 9 for the day. This is a PYQ, just wanted to revise this क्योंकि most of the time they ask this about oral contraceptive pills. All of the following are non-contraceptive benefits of OCPs except protection against fibrocystic disease, protection against PID. PID में आप intrauterine device नहीं देना है, but OCPs तो दे सकते हैं. ठीक है, protection against ovarian cancer, protection against cervical cancer. Please remember, oral contraceptive pills increase the risk of, ठीक है, put a person on the risk of cervical cancer and breast cancer. They are protective for endometrial cancer and ovarian cancer. Since exam is very near, 10-15 दिन बचे हैं, है ना, so we can't go into too much detailing, but you have to know these facts. जैसे non contraceptive benefits में मुझे क्या याद रखना है जो बहुत expected है exam में? ये which two cancers it is protecting? OCPs, ovarian and endometrial. Which cancer risk increases? Which cancer risk increases, guys? So कौन से cancer का risk बढ़ जाता है? Cervical cancer and breast cancer. Okay, but it is protective against benign breast disorders, ovarian cyst, iron deficiency anemia, obviously क्योंकि last के 7 days iron की गोली खानी है. And which iron tablets is it? Ferrous sulfate or fumarate? It is fumarate. कितना elemental iron होगा? कोई पूछ लिया तो 60 milligram elemental iron. ठीक है, osteoporosis, PID, of course, ectopic pregnancy as well. ठीक है, non contraceptive benefits of OCP. चलो, question number 10. Which contraceptives would you advise to a breastfeeding woman? One of the expected things. ये जो भी मैं लास्ट के PSM बूस्टर में करा रही हूँ ना, ये सब सबसे ज़्यादा आने के चांस है गाइज, इसीलिए हम लोग को इनको इन सेशंस में कवर करना है. ठीक है, contraception option, okay, yeah, contraception option बंद हो गया लाइक. Just give me one moment. Just give me one moment. I will connect the pen ones. Okay, you try the answer. I mean, it's not visible right now, but जो भी हमने किया है, you can revise. Just give me one moment, or else we'll have to do these 10 questions only. Okay, I'll read out the question to you. Question was, contraceptive option available to a 28-year-old breastfeeding mother with a 6-week-old baby wishing to avoid next pregnancy are all of the following except Implanon, IUD 380A, LNG IUD, OCP. हमेशा याद रखना गाइस, कोई भी ब्रेस्ट फीडिंग वुमन हो उसमें OCPs you will advise only after 6 months. Okay, after 6 months of delivery. ठीक है, but एक question यहाँ पे, how will the examiners trick you? They will give you a question that the woman is, they will give you a question that कि the baby woman has delivered but she is not breastfeeding. Okay, the woman has delivered but she is not breastfeeding. So if you get a question that if the woman is not breastfeeding, OCP कब तक दे सकते हो? In that case you can give till to after 21 days. ठीक है, but in case the woman is breastfeeding you will never advise OCP till 6 months. ठीक है, all right. Did you understand? But अगर अब आज के टाइम पे क्वेश्चन आ चुका है which is an update also, what is the contraception of choice for a breastfeeding woman? बताओ, contraception of choice, contraceptive of choice for a breastfeeding woman, for a breastfeeding woman. What is your answer over here? Please don't say IUCD. पहले IUCD था, but as per new guidelines IUCD can be inserted only up to 48 hours of delivery or after 6 weeks of delivery. In between we cannot use it. ठीक है, so now it is none other than progesterone only pill. I have discussed this in short session also. Progesterone only pill. So ये वाला टेबल देख लो. ठीक है, समरी ऑफ इनिशिएशन ऑफ फैमिली प्लानिंग मेथड पोस्टपार्टम. ओके, एक्सपेक्टेड MCQ. ठीक है, पहले तो 2 सवाल ये बनते हैं कि कौन कौन से कॉन्ट्रासेप्टिव्स फ्रीली मिल रहे हैं IUCD में 380 375 within 48 hours of vaginal delivery or concurrently with C-section when it's going on or after 6 weeks of delivery, never in between, and you have to take the consent of the woman every time. Then injectable DMPA, you remember, Antara 150 milligram intramuscularly given for 3 months, right? Antara. ठीक है, दिस इज अ न्यूअर कॉन्ट्रासेप्टिव नाउ अवेलेबल टिल द लेवल ऑफ सब सेंटर. ये आप ब्रेस्ट फीडिंग वुमन में 6 weeks आफ्टर डिलीवरी एडवाइस कर सकते हो, अर्लियर दैन 6 weeks इन अ नॉन ब्रेस्ट फीडिंग. OCP आफ्टर 6 months, नॉन ब्रेस्ट फीडिंग लाइक आई टोल्ड यू एनी टाइम ऑन डेज 21 to 28 days. बट इसको ध्यान से देख लो, POP अर्लियर दैन 6 weeks ब्रेस्ट फीडिंग, नॉन ब्रेस्ट फीडिंग. आइडली गाइज, एनी वुमन हु delivers, please ask the couple to avoid sexual intercourse till 6 weeks after deliveries. But in case they want it, you have to prescribe the couple progesterone only pill. ठीक है, चलो, moving to the next question for the day, everybody. Come to this one. 5 more questions. OCP can be advised safely to a woman in which of the following conditions? Breast cancer, congenital hyperlipidemia, liver disease and PID. मतलब क्या टॉपिक है? एडवर्स इवेंट ऑफ OCP. OCP खाने से क्या क्या होने का खतरा है, बताओ. I mean, puts the woman at risk of. Very good. Quick answers you're giving. PID. PID में क्या contraceptive नहीं use करना है? IUCDs. Okay, intrauterine devices. Alright. So now if any woman has PID, you can put her on OCP. And the problem with OCP, guys, most important are the heart effects. Okay. So in that, look at this presentation. Let's revise this. Absolute contraindications. 2 कैंसर बढ़ाता है, ब्रेस्ट एंड जेनाइटल में याद रखना, सर्वाइकल, कार्डियक अबनॉर्मैलिटीज, किसी को भी कभी थ्रोम्बोएम्बोलिज्म है, ठीक है, किसी को भी कोई तरीके का CVD है, एनी वुमन यू विल नॉट एडवाइज हर ऑन OCP. कंजेनाइटल हाइपरलिपिडीमिया, abnormal uterine bleeding, liver disease and thromboembolism. ठीक है, these are all this thing. So if somebody tells you contraception of choice in a newly married healthy couple, okay, contraception of choice, okay, if somebody asks you contraception of choice, okay, in newly married but the couple, newly married couple में सीधा आंसर OCP नहीं होना चाहिए, couple को healthy होना चाहिए, woman को healthy होना चाहिए. ठीक है, in a newly married healthy woman, okay, that is OCP. Obviously OCP has lesser failure rate than barrier methods. ठीक है, but if she is having some heart problem, newly married, you can't put an IUCD. In a woman who is nulliparous, you can't insert an IUCD, it's difficult. So the best thing out of that over there, you can't advise her tubectomy because she is newly married, she doesn't have children. Tubectomy के लिए एक बच्चा, one child more than 1 year of age, that is a must, right? Both for tubectomy and vasectomy. Okay, so here what will be your answer? In that case it will become barrier method. ठीक है, then I hope you remember this image from the videos as well. The inverted triangle is that of family planning logo. इसमें से कौन सा contraception, कौन सा OCP free of cost है? N stands for no cost, free of cost. D stands for like D you can remember दुकान में पैसा देना पड़ता है. So Mala D is not available free of cost. It is promoted under which scheme, guys? It is promoted under a social marketing scheme. We will talk about that. Contraception of choice for a couple in a long distance. Okay, यहीं पे बता देती हूँ. If the question comes contraception of choice, okay, contraception of choice for couple in different cities, like somebody asks, or couple in long distance, okay, or couple who meets occasionally, okay, who meets occasionally. Now we are going to go for IUCDs, okay, or IUDs, all right, intrauterine devices, all right, intrauterine devices, because they have IUCDs, because they have lower failure rate than barrier methods. They have lower failure rate than a male condom, okay, lower failure rate than barrier method. They meet occasionally, obviously they would not want to get pregnant, okay. So barrier method इसका आंसर नहीं है. The answer to that question becomes IUCDs, okay. All right, now look at this OCP का value देख लो. combined OCP में प्रोजेस्ट्रॉन कितना है? 0.15 mg, ईस्ट्रोजन 0.03. हार्ट डिफेक्ट्स किसकी वजह से होता है? ईस्ट्रोजन की वजह से होता है, ठीक है, हार्ट प्रॉब्लम्स, ओके. सो वी डिक्रीज्ड दी डोज ऑफ ईस्ट्रोजन. प्राइवेट में जो टैबलेट्स बिकती हैं OCPs उसमें और कम ईस्ट्रोजन होता है, 0.02, ठीक है. सो यू कैन जस्ट रीड दिस, ऑल राइट. Barrier we are not going to advise over there, only considering the failure rate, ठीक है. Kartika, did you understand? Only considering the failure rate, okay. Come to this one. Vasectomy is the most cost effective method of contraception. Eligibility criteria for male sterilization includes all of the following except client should be married, has at least one living child whose age is above 1 year. Clients can be between 18 to 60 years old. Clients or their spouses must not have undergone sterilization in the past. सबसे कॉमन मिस्टेक स्टूडेंट्स क्या करते हैं? जब भी उनसे पूछो, वेन एवर यू आस्क देम कि वेसेक्टमी और ट्यूबेक्टमी के लिए क्या क्राइटेरिया है, 2 बच्चे या 1 बच्चा, हमेशा दे थिंक 2 बच्चा. 2 child is the, like India follows a 2 child norm, okay, that 2 children, a couple should have 2 children, boy girl any would do. But for vasectomy or tubectomy, guys, 1 child more than 1 year of age, that is the criteria. And for vasectomy, here we are talking about vasectomy, it is the most cost effective, least failure rate, but hardly practiced in India, less than 0.01% मान लो, ठीक है. Client should be 18 to 60 years, नहीं. Male का कितना एज होना चाहिए for vasectomy? At least 22 years, ठीक है. Should be below 60 years. Couple should have at least 1 child above 1 year. They must not have undergone sterilization in the past. They must be in a sound state of mind. If not in the sound state of mind, they have to be certified fit by a psychiatrist, ठीक है. Don't make this mistake कि ट्यूबेक्टमी एंड वेसेक्टमी हम 2 बच्चों के बाद ही करा सकते हैं, नहीं. 1 child more than 1 year of age. One more question. If a man wants to get a vasectomy done, does he need his wife's approval? Or if a wife wants to get a tubectomy done, does she need her husband's approval? No, nobody needs anybody's approval for vasectomy or tubectomy, all right. 1 point. Also, since we are talking about approvals over here, please remember for MTP also a woman does not need the permission of the husband, okay. ये सारे conceptual facts है जो exam में पूछ सकते हैं as one liners or as options. That for MTP does a woman need the husband's approval? No. MTP Act will be discussed in one of the sessions, guys, okay, when we come towards the end of the sessions of the PSM boosters, okay. Alright, so these are just you'll find it in the PDF also. Man, female के लिए भी married, female के लिए age होना चाहिए 22 से 49 years. क्यों 49? Why not 60? Because reproductive age of a female is up to 49 years. More than 1 child, more than 1 year of age. No past history, same thing like we just did it for male sterilization. अच्छा, male sterilization के बाद एक question आजकल बहुत आने का chance है, which is that Post vasectomy, is the man immediately sterile? No. Post vasectomy, what advice would you give to a couple? Post vasectomy, what advice would you give? Okay, post vasectomy, one second, this is the next. Yeah, post vasectomy, kya advice doge? The couple is not immediately sterile, they need to use a barrier method for at least 3 months. Okay, all right. Or the man has to be 20 ejaculations free. पहले क्या था इसका आंसर? 30. अब ये अपडेट है, ठीक है? कितने ejaculations free? 20. But he might not be able to keep a count. So best is to use a barrier method for 3 months. But question आता है कि एक couple ने vasectomy कराई, a man ने, and the woman reportedly got pregnant. What is the most common cause of failure of vasectomy? ये मत लिख देना did not use a barrier method. सबसे common cause of failure of vasectomy क्या है? सर्जरी के टाइम ही हो जाएगा, प्रोसीजर के टाइम ही हो जाएगा, मिस आइडेंटिफिकेशन ऑफ वास. ओके, दिस इज द मोस्ट कॉमन कॉज ऑफ फेलियर ऑफ वेसेक्टमी. मोस्ट कॉमन कॉज ऑफ फेलियर ऑफ वेसेक्टमी ऑब्वियसली मिस आइडेंटिफिकेशन ऑफ वास. और वास डिफरेंस का कितना पोर्शन कट होना है? एटलीस्ट 1 सेंटीमीटर हैज टू बी कट. ओके, एटलीस्ट 1 सेंटीमीटर. ठीक है, ऑल राइट. Please remember all this because you might be in a rush and you might end up marking कि 3 months barrier नहीं यूज़ किया, वो तो सर्जरी के टाइम ही हो गया. ठीक है, चलो वेसेक्टमी ट्यूबेक्टमी डन. टाइमिंग देख लो, आई वांटेड टू रिवाइज द टाइमिंग अबाउट ट्यूबेक्टमी. ओके, पोस्टपार्टम स्टेरिलाइजेशन का टाइम पूछ सकते हैं. लाइक आफ्टर द वुमन हैज़ गिवन बर्थ, व्हेन शी इज इन द पोस्टपार्टम पीरियड, इट कुड बी डन बिटवीन 24 hours to 7 days of delivery. Since we are talking about this, tell me what is the best time to insert an IUCD? Best time to insert an IUCD. Best time to insert IUCD. Please don't say postpartum. बहुत सारे स्टूडेंट्स पोस्टपार्टम बोल देते हैं. पोस्टपार्टम IUCD एक्सपल होने का चांस बहुत ज़्यादा होता है. बेस्ट टाइम क्या है? बेस्ट टाइम इज ड्यूरिंग मेंसेस. बट डू यू थिंक अ वुमन इज गोइंग टू टर्न अप ड्यूरिंग हर मेंस्ट्रुअल साइकिल्स टू गेट एन IUCD इंसर्टेड? नो. देयरफॉर मोस्ट रिसेप्टिव टाइम क्या होता है? व्हेन शी इज गोइंग टू रेडिली अग्री, बिकॉज शी माइट बी टू टायर्ड, शी ऑलरेडी हैज टू मेनी चिल्ड्रन, she is exhausted, so she will say, she will agree, she will give you a consent. So most receptive is postpartum. But abhi postpartum में भी time अब कितना है? Within 48 hours of delivery या after 6 weeks. ठीक है, good. चलो, let us move forward now. Just a few more things we'll revise. Okay, all right. Now last thing, emergency contraception का drug of choice बताओ for emergency contraception. USP and Lance regimen, danazol, LNP, levonorgestrel only pill, high dose estrogen alone. क्या है इसका आंसर? Drug of choice. Now we all know nowadays there is one tablet which is being used. Okay, I pill बोलते हैं, easy pill बोलते हैं, unwanted 72 बोलते हैं. It's being used a lot. Okay, and this is the most preferred. Okay, but it's not the best. Okay, now this is going to be a single tablet. Pink color की एक tablet होती है that can come as an image based question to be taken within 72 hours of unprotected sexual intercourse. Danazol can also be used as an emergency contraception. But guys, which is the best? Let me show you a list once. See, पहले USP method use होता था. USP method was combined OCP. फिर अब क्या use होता है? Levonorgestrel only pill. You can also use ulipristal, which is a selective progesterone receptor modulator. Mifepristone का डोज बदल दो, 200 मिलीग्राम. ठीक है, 200 मिलीग्राम. 600 मिलीग्राम में भी use it as used as an abortion drug. Research ने दिखाया 200 मिलीग्राम में also it can work as an emergency contraception. Now they are also doing that can it work with 10 milligram. IUCD is the best. Okay, inserted up to 5 days. Inserted up to 5 days of unprotected sexual intercourse. 5 days of unprotected sexual intercourse. ठीक है, you can get a question on on these emergency contraceptions. ठीक है, चलो, good. Now let's go to the next thing. This is iPill. Okay, one pink color tablet which you already know. Chalo, identify this contraception image based question out of the barrier methods. Question number 13. This one's important. V shape का ring है. V for vagina, वी शेप का रिंग नहीं, वी शेप का बैंड है. सो वी फॉर वजाइना एंड दिस इज व्हाट vaginal sponge. Okay, now what are the questions that you get from vaginal sponge, guys? This is available under the brand name of Today. This is a barrier method, prevents sperm and ova from meeting, and also it contains a spermicide, guys. उस spermicide का क्या नाम है? Non-oxynol 9. Okay, non-oxynol 9. Now is it being recommended? No, there are a few reasons. I'll just verbally tell you. Number one, it needs technique to insert. Okay, it has to be pushed into the vagina, it has to be inserted into the vagina, then it has to be pushed gently to be placed over the cervix. So you need to teach the woman that, she has to be motivated. The other thing, it does not, it's a barrier method but no protection from STDs, HIV. Another thing, you need to plan your sexual intercourse. It has to be inserted 6 hours prior to sexual intercourse and it has to be left up to 6 hours after ejaculation. And in case the woman forgets to take it out by 24 hours, it is a foreign body, it will lead to toxic shock syndrome. Okay, plus one more question, can it be reused? Yes, it can be washed and it can be reused. Only educated woman can be given this. And similar to this is, guys, a diaphragm or a cervical cap, okay, which is like that. Everything is same. Diaphragm has lower failure rate than a vaginal sponge, but neither the diaphragm nor the vaginal sponge protects us from sexually transmitted diseases. Okay, all right, now ये है देखो, this one is your diaphragm. Okay, this one image can come. और सिर्फ आपको ये टुडे का फोटो दे देंगे. टुडे में बोलेंगे ये क्या है. टुडे इज द ब्रांड नेम फॉर वी शेप्ड रिंग वाला. ये क्या है? vaginal sponge. Okay, this is what vaginal sponge. Okay, moving to one more thing, look at this image. Is it a male condom or a female condom? Male condom usually नहीं आता एग्जाम में. They give us this female condom identify करने. इसमें 2 rings है. एक ring cervix पे जाएगा. The other ring is outside in the vulva, so it interferes with sexual intercourse. Another point with female condom, guys, is that very important, Government of India doesn't provide us freely under National Family Welfare Program. It is being provided under NACP to commercial sex workers. Targeted intervention. Okay, this is a TI, targeted intervention under National AIDS Control Program. Obviously protects from STD HIV. ठीक है, protects from STD HIV. ठीक है, which is very important for a commercial sex worker. Okay, protects from STD HIV. Can be reused. Now option में दे सकते हैं, can a male and a female condom be used together? No, male and female condom cannot be used together. This is available under the name, it was discovered by whom? MD Hessel. This is an important question. Okay, female condoms. Chalo, come to one more question for the day, which is missed pill. Going to look at missed pill and pearl index. Okay, in case of woman on OCP forgets taking pills on 3 consecutive days, what should she do? Take 2 pills each for remaining cycle. Take 3 pills next day and continue with 1 pill per day. Use barrier method for rest of the cycle. Continue with next pill day onwards. क्या mark करोगे? Now कभी भी guys problem 1 या 2 pill miss करने पे नहीं आती है. Problem आती है if a woman misses more than 2 pills. Okay, now if she misses, so let's go to its management. Okay, now look over here. Missing 1 to 2 pills. If you miss 1 to 2 pills, take 1 pill as soon as possible or take 2 pills at the scheduled time. No risk of pregnancy. ठीक है, like somebody was supposed to take today at 10 o'clock, misses it. Tomorrow while she is in the afternoon, she remembers, she can take the missed pill and she can continue with the remaining schedule, or at night only she remembers, she can take both the pills. Now look, misses more than 3 pills in the first or second weeks, or she has started a new pack 3 days late. Okay, here she will take 1 pill as soon as possible. She can't take 3 pills or 4 pills or 5 pills together. That is absolutely wrong. She will continue with the scheduled pill, use barrier for next 7 days, or avoid sexual intercourse. But if she has had unprotected sex in the last 72 hours when she missed her tablet, the couple has to use emergency contraception. ठीक है? Missed more than 3 pills in the 3rd week when the cycle is about to finish, she will take the 1 pill as soon as she remembers. She will finish rest of the hormonal pill and the iron tablets, which is ferrous fumarate. Okay, that she is going to discard. Then she will start a new pack the next day. Avoid sexual intercourse or use barrier method for 7 days, and in case of unprotected sex in the last 72 hours, she is going to use an emergency contraception. Question mostly बनेगा guys, 3 pill miss किया है. 4 पिल मिस किया है, बैरियर मेथड यूज़ करना है, और अगर अनप्रोटेक्टेड सेक्सुअल इंटरकॉर्स किया है तो इमरजेंसी कॉन्ट्रासेप्शन यूज़ करना है। और अगर एग्जामिनर को थोड़ा और आपको परेशान करना है तो वो लिख देगा कि 3rd वीक में मिस किया है। तो 3rd वीक में जब मिस करते हैं तो उसमें एक एडिशनल चीज़ करना होगा, आयरन टैबलेट्स नहीं खाने हैं, उसको डिस्कार्ड करके नया पैक जैसे 3rd वीक ख़त्म होता है यू हैव टू स्टार्ट। गॉट इट एवरीबडी? ठीक है, दिस आई विल पुट आउट ऑन टेलीग्राम ऑल्सो टुडे, सो प्लीज हैव अ लुक एट दिस इज एक्सपेक्टेड। सो यूज बैरियर मेथड फॉर द रेस्ट ऑफ द साइकिल। ओके, चलो कमिंग टू द लास्ट क्वेश्चन, आई हैव नॉट रिटन इट, आई एम गोइंग टू राइट इट। ठीक है, 100 कपल्स, क्विकली फॉलो दिस, 100 कपल्स यूज कॉन्ट्रासेप्शन Z, use contraceptive X, okay, for 2 years, okay, for 2 years. 20 accidental pregnancies reported, 20 accidental pregnancies reported, 20 accidental pregnancies reported. Question is calculate Pearl index, calculate Pearl index. So let's do it right now only. Calculate Pearl index for contraceptive X. Pearl index is a measure of contraceptive efficacy, okay. Now what is the formula for Pearl index, guys? Number of accidental pregnancies, okay, number of accidental pregnancies जितने भी हो रहे हैं divided by the total months of exposure, okay, divided by the total months of exposure. And what are you going to multiply it? 1200, okay, you're going to multiply it 1200 because there are 1200 months and 100 years. We express the failure rate in 100. So number of accidental pregnancies यहाँ पे कितने हैं guys? 20. कितना total months of exposure है? 2 years, मतलब 24 months. But how many couples used it? 100. Please don't forget to multiply with 100, the most common mistake again. So it is 10 per 100 woman years. Alright, so remember this, don't forget to multiply with this. Another measure of contraceptive efficacy is life table analysis. Remember, life table analysis is better than Pearl index. Okay, now why? We are not going to go into that right now. But yes, if you get that life table analysis, kya hai? It is a measure of evaluation of a contraceptive method. Clear? Okay. So that was 15 questions for the day. एक और चीज़, बस 2 इमेज लास्ट में बता रही हूँ. ये अंतरा देख लो, न्यू कॉन्ट्रासेप्टिव है, डीपोड मिड्रॉक्सी प्रोजेस्ट्रॉन एसिटेट इंजेक्टेबल कॉन्ट्रासेप्टिव which is freely available till the level of the subcenter, and the other one which is freely available till the level of the subcenter is centchromin. Yeah, selective estrogen receptor modulator, all right, centchromin, which was earlier known as Saheli. Okay, अब इसका क्या नाम है? इसका नाम है छाया. इसमें कौन सा केमिकल होता है? ऑर्मेलॉक्सिफेन. ठीक है, so the 2 contraceptives which are freely available till the level of subcenter now, Antara and Chaya. Got it, everybody? Okay. Non-steroidal hormonal contraceptive. Very good. So that's the end of this session. In the PDF, you'll find the failure rates. Usually not asked, but just go through these failure rate once. They might ask you for a female condom, or they might ask you for a vaginal sponge. Okay? So you can have a look at just a few failure rates from this. Okay? So that's it for today. Please join the quiz and Telegram group today at 8 p.m. Everybody, don't miss out on that. Kal you're not going to have a class, so if you don't have a class doesn't mean you're not going to revise PSM. Quiz kal hoga 8 baje. परसों मिलेंगे same time vaccines and NIS के लिए. From 27th, we will have 40 to 45 minutes class where we might look at 10 to 12 MCQs. But don't forget to tune in, guys. Do share it with your friends also so that they can benefit from this session. ठीक है? Yes, if missed for Antara 2 weeks before, ठीक है, 4 weeks after, it can be used. Yes, that came as a question in INICT once a month. Okay, good. All right. No, IUCD Kartika, it can be inserted up to 48 hours. What I have shown you, that is the latest update. Okay? Chalo, thank you so much. Have a good day and keep revising, keep studying. Don't give up. बहुत कम समय बचा है, so stay focused, don't get distracted, and I'm sure you all will get through. Okay? Bye-bye.